adult orthodontics. You do a lot of ortho in your practice.
Right. We have a lot of patients that they had ortho when they were a kid, and now their teeth, especially on the lower, have started crowding again, and they want to get them straightened back up. It's super important that we hold them there, we keep them there after we've done that. But what we see a lot of times, I mean, you're in the news, people, when you talk, your lower teeth show.
That's a good point.
People can see that.
Yeah.
When we smile, our upper teeth show. But when we talk, our lower teeth show. So we live in Atlanta, which is the new filming capital of the world. So we have a lot of patients. They're in movies or trying to be in movies. And they need them straight because when they talk, they can see all those down there. And it's better from a health perspective. You can clean around them better. But the great thing about it for adults, when we're focusing on the aesthetics of the smile, we can get them straightened in under 6 months. And the majority of the time for our patients, we recommend they do a short-term orthodontics, and we use white brackets and white wires. And the reason we do that is because
that's nice.
They're less noticeable. The old silver ones, you think Ugly Betty, you know?
Yeah.
The way they made Ugly Betty ugly is they gave her silver brackets, you know, in glasses, but in bangs. But for our patients, the white brackets and the white wires, they're less noticeable. We do a lot of Invisalign as well. The only disadvantage is you have to be very consistent with wearing them. If you wear them consistently, 22 hours a day is what they recommend. Invisalign works really well at straightening the teeth, and you can take it in and out. I prefer to be able to keep them on them so that I can get the result that I need in a much faster period of time.
So these white brackets, like in 6 months you could be done. Like in between cleanings, you have brand new straight teeth.
For people that had ortho in the past and the things have just crowded, then yeah, 6 months is all you need. We do a lot more complicated cases as well for people that have had other problems, maybe pulling canines down that never came down, or other complex things with lots of spaces or crowding. But for the basic case, for someone that's a relapse case, then 6 months is more than enough. Sometimes we can do it in even 3 months. So